I rise as your leader. You know, there are often times on this floor where we not only preach, but we practice bipartisanship and nonpartisanship, and we solve problems. I'm very proud of that. Certainly respect all my colleagues. But there are times to have a real argument and a fight here, and this may be one of them. Because when Republicans talk about opposing this bill, I think the fair question to ask is, what do you support? And the record itself has been pretty clear, because when Governor Schwarzenegger, Republican Governor Schwarzenegger, in 2007 sponsored a employer-based private health insurance plan expansion, there was not a single vote on your side of the aisle for that plan. In Washington, D.C., as President Obama and legislative Democrats have worked tirelessly, imperfectly, but tirelessly to put forward a private-based health care system expansion, not a single Republican vote. And so what are you for? Let us stipulate here on the floor today that single payer is a long way off. Not going to get signed into law this year, even if it passed. But the demagoguery needs to be answered and addressed. Read what you want out of Massachusetts. Read what you want out of Massachusetts. But I've looked at the exit polls, and I know in a state that already has health insurance, so they're not comprehensive health insurance, so they were not rejecting comprehensive health insurance, that 71% of the independents who went largely for Senator-elect Brown support a public option. So one reading out of that election is that the voters were disappointed in the majority party and the president for not, frankly, going far enough and engaging in some pretty obvious sausage making when it came to Ben Nelson and Nebraska and all that occurred there. So take what you want from Massachusetts. I take something a little bit different. Senator Strickland asks, or says, excuse me, that this bill shocks me. Different words from some of my other colleagues, but a similar sentiment. Well, I want to ask you this. Where is your outrage? And more importantly, where is your work product around supporting an expansion of the private health insurance system? And why is it that you continue to defend a system which, frankly, is out of control when it comes to costs and when it comes to the plight of businesses, especially small businesses? Where is your outrage about the fact that our health care costs are rising under the current system at 2.5 times the rate of inflation? Where is your outrage that by 2025, $1 in every $4 in our nation's economy will be spent on health care? Where is your outrage, the party of economic development of jobs, that employer-sponsored health insurance premiums have nearly doubled since 2000, a rate 3 times faster than the growth in wages? Where is your outrage, the party that purports to stand for working families, that the average premium for a family plan purchased through an employer in 2008 was $12,680, more than the cost of tuition at UC? Where is your outrage about the fact that small businesses under the current system pay up to 18% more per worker than large firms for the same health insurance policy? And that these costs are passed on to employees in the form of lower wages and eat into the profits of small businesses? Where is your outrage that nearly half of small businesses in the country report that their health care costs have had a negative impact on other parts of their business, including investing in more capital? The status quo is hurting California families. It's hurting California businesses. And Senator Runner raises the question about Senator Leno's correct claim, in my view, that while you can talk about $200 million, billion, thank you, $200 billion, what is your answer to the undisputed study that since 1970, Medicare's average annual per enrollee growth rate of 9.6% is lower than the growth rate of 11% for private health insurers? You call it single payer, we call it single payer. For political purposes, you call it socialized medicine. I'd remind you that many of your parents and grandparents are in fact recipients of that very system you decry. It's called Medicare. And a better term for Senator Leno's bill might just be Medicare for all. On the fundamental point that Senator Runner raises about the fact that the billions of dollars that it may cost taxpayers, whether they are in fact offset by the billions that would be saved because employers and individuals don't have to pay money as ratepayers, a dollar's a dollar. You know, our constituents don't frankly care whether or not we take it out of their pocket as taxpayers or as ratepayers. The fact of the matter, they're paying either way. And under this current system, they're paying a whole lot more and getting a whole lot less than they deserve. So let's have the political argument. That's fine. Respect your point of view on the issue. But it's not enough to be representatives who can reflexively say no to any proposal that comes before this floor without fundamentally addressing how you would expand coverage for the millions of people without health insurance. I ask for an aye vote on this important measure.